I'm your consumer investigator, Dale Cardwell, and you're watching TrustDale-TV. Sneezing, colds, allergies. We're all annoyed by them, but what can you do about it? As many of you know, TrustDale has now expanded into health and wellness categories with TrustDale-Health.com. Today, I have a medical expert who will share her expertise on ear, nose, and throat problems that affect all of us. With us is Dr. Elaina George, a board-certified ENT specialist and surgeon. How are you, Dr. George?
I'm fine, Dale. Thank you.
It's my pleasure. Thank you for being here. Tell us what attracted you to this particular area of practice.
Well, it's the dynamic aspect of being an ear, nose, and throat doc. You get to see everything, adults, children, and you're taking care of people not only surgically but medically. Well,
tell us a little bit about the types of issues you treat.
Everything from tonsils and adenoid infections, sleep apnea, snoring, allergies, asthma, even cosmetic procedures and head and neck cancers.
As a surgeon, what are some of the procedures you perform?
Tonsillectomies, adenoidectomies, snoring and sleep apnea surgery, endoscopic sinus surgery, some head and neck surgery, and balloon sinuplasty.
Fascinating, because the areas that you treat are things that it's right here, so people are very conscious of how they feel and how it affects them. Let's talk a little bit about colds and allergies. We all seem to suffer from them, obviously, but how do you tell the difference between a cold and an allergy?
It's a really good question. I think a lot of people end up on antibiotics a little too soon. Most colds are virus-driven, and your symptoms can feel horrible. Body aches, fatigue, lots of congestion, but it's really a timing sort of thing. So if it lasts more than about 5 days and the mucus starts to get thicker, discolored, it's not getting better. That's when you need to start thinking it's not just a simple cold, and it may be something that's bacterial. And if it does resolve with an antihistamine and just kind of a steam shower type of deal, it's most likely allergy.
Very interesting. You're also very well versed in another area that we've all heard of. It's called Obamacare. Give us some idea of what we could expect from this.
Well, it's going to be a change for patients. Starting in 2014, everybody's going to be mandated to buy health insurance. The states will run health insurance exchanges, and if you can't get health insurance through your boss, then you'll have to enter that system. And if you don't, there will be penalties. Upwards of $600 per year if you don't sign up for health insurance.
But I've heard talk that some people might simply not sign up because the penalty is going to be less expensive than perhaps getting health care.
That's true, especially in a small business arena where it's about $2,000 a year. It's cheaper than actually buying insurance for your employee, which can be anywhere from $6,000 and up per year. So you might be having a savings if you decide not to if you opt out of that.
How does this affect doctors?
That's the biggest thing that I think people are going to find. The access, which was the promise of Obamacare, that you could keep your doctor and see whoever you like, is not really going to happen. We're seeing changes already. Doctors are leaving. They're retiring early. They're going into different fields altogether. For others, they've limited their scope of practice, so they're not doing everything that they trained to do. Others are no longer taking Medicaid or Medicare. And other docs are literally becoming concierges so that they don't take insurance at all. You have to literally buy a year membership in order to see your doctor.
Very interesting. This is part of the reason that we've asked Dr. George to join us, because she has a great bedside manner and she can actually make this information plain to us so that we can understand it. And of course, healthcare reform is going to be a hot topic this year. So Dr. George will be returning with us in future shows with more updates. In fact, I'm happy to welcome Dr. George as our new TrustDale medical expert. Thank you so much for joining us today.
Thank you. I look forward to coming back.
I can't wait either.